So where we've had success using locums is in that strategic bucket, where rather than being reactive, for example, we're helping to stabilize service lines, preventing burnout during surges, covering leadership transitions, and then intentionally using that locums as a bridge to permanent hires, rather than just for that temporary coverage that Chris mentioned.
Yeah. Janet, I saw you nodding your head specifically on the training piece, right, and making sure that everybody is involved, the culture element, which is so crucial.
Yeah.
But what does this look like for you, right, when it comes to managing them separately? Are there certain issues that come to mind for you specifically? And then also, what are some of those non-traditional ways that you've seen locums really make a difference for organizations?
Oh, absolutely. And I was listening with some of the things Chris was saying. I was going, yes, that's, he hit it right on the head, right? Because, you got locums are people, right? You got to think about when you look at it from their point of view, they're coming into a system where they've never been. They're stepping foot into a hospital. They've talked to a couple people there, but hey, I'm coming. I'm going to work with you guys for a week, for a month, for 6 months. And you really have to do on that front end, that onboarding. You need to treat them just like you would treat a brand new employed physician coming on to your medical staff and joining your medical group, because these people are assimilating into your group, and they're learning from the culture that you have. So for the success of them, for the patients, for everyone, you really have to bring them in together and really say, hey, how can we help you be successful? Because if you don't, it's not going to work. And what we've done, what I've seen done in the past is, if we were trying to start a new service in a community where we were having a lot of challenges recruiting, could be location, there are certain specialties out there right now that taken 3 years to recruit, even in metro areas, right? And so we've used them to help establish a practice there. So it makes it easier for us when we're trying to recruit that permanent physician. Hey, we've already got a practice established here. And, it helps them. You've got a patient base, you've already got routines set up. So we've seen that successful for us. And then, as Chris talked about, having physicians sometimes give this is a good opportunity for them to say, hey, maybe I want to stay here. And we've had that happen. I'm going to say probably on an average of about 2 or 3 a year, which we feel like is a great testament to our culture that we've done that well, for people to come and they say, you know what, I like it here and this is where I want to be. So, but at the end of the day, it's all of those pieces to help everyone be successful that's going to help the medical group and the health system with it. But and as Teague said, you can't just look at this as a cost center, because we credential every locums with the payers, every one of them. You have to bill for those services. And you have to take into all of that account. Yes, a locums costs more than a regular employed physician, but you think about what you would be missing, the access to care, the not being able to cover call, et cetera. It weighs out in the end. So you have to really look at the bigger picture when you're bringing in a locums.